yourself potentially. Simple hand washing after any of those activities for at least 20 seconds with soap and water will get rid of it. I have been telling people to, when they come in, obviously take off your shoes, put your clothes in a laundry container, and go and take a shower if you've been anywhere other than outdoors, far away enough from other people. The recommendations I gave a little over a week ago in terms of prevention, the items that have kind of surfaced to the top in terms of if I had to narrow those recommendations and as much as they are available, separate from the avoidance activities and things that are calming to your nervous system, which I just cannot reiterate enough. And I'm currently in conversation with several people and referral sources that I've sent many of you to, even to host another discussion that's specifically focused on practices that can re-engage your neurophysiologic pathways should they get hijacked by all the overwhelm and stress and worry that this may be creating. Luckily, a lot of you seem to be handling, the whole situation quite well. I haven't actually come across, extreme fear, which is also quite helpful. And, we're just, as much as I can, like, continue to bring more information your way, because it does appear that I'm seeing some information days ahead of the general public, just based on, access and collegiate groups and analyzing of data and studies and information. So as much as there's new things to share, I will do my best to communicate those along the way. So for those of you who weren't stopped in yesterday, I do see a few of you here. And as much as you can access from a prevention standpoint, there has been a little bit of mixed information out in the interwebs around certain things that are commonly used to help modulate the immune system in the face of a respiratory viral illness, such as vitamin D3. I just got another brand new report that I haven't dug into, but the consensus thus far and the medical literature that I've read myself is suggesting that it is still quite good for prevention and it absolutely should be used. Average dosing for adults, trying to get levels at least above 50, which is the immune supportive blood levels, is an average of 5,000 units a day. There are exceptions to that, but for the time being, that seems to be a greater consensus that it is safe and worthwhile and high yield, versus the few little bits of information that suggest there's one particular pathway that it could interfere with in relationship to acquiring the virus and the inflammation that leads to the impact on people's lungs. So I would focus on that. I would focus, if you have it, on zinc. So if or zinc rich foods, which I can also post some things about that as well on the other end of this. Zinc, blood levels, keeping them at a healthy place should you get the virus is one of the main defenses that we have for dismantling viral replication inside the cells. In my practice, I probably, especially over the last year or two, I've done much more testing of zinc for other reasons, and most people tend to, in my patient population, tend to err on the side of being a little deficient, and just an average daily dose through this kind of more acute phase of the virus spreading would be reasonable if you can get it at 30 milligrams a day. Again, I'm gonna post some zinc rich food sources, because if you can focus on food sources too, that's also food is medicine and an even better option, particularly if you're finding that things are in short supply, whether you're on Amazon or our supplement vendor or otherwise. It is true that there is some supply chain issues. And so, we're trying to get creative and find alternatives should that be a problem. So vitamin D, zinc, and then prevention dose of vitamin C at 2,000 milligrams. And again, most of you know what foods are rich in vitamin C, and I'll elaborate on that too. Those are the mainstays that I think I would focus on from a supplement standpoint for prevention. And then there's nuance, of course, when it comes to other factors at first signs of illness, ramping your vitamin C doses. If you have access to quercetin acts like hydroxychloroquine, which is one of the drug treatments in question that has been showing efficacy in other countries that are FDA and people in the US are analyzing for potential efficacy for treating active infection along with azithromycin. There are inherent risks to any drug treatment, which makes using natural agents that have the same mechanism of action not a good alternative, particularly in mild illness. So quercetin creates the channels that allow zinc to be more easily absorbed into the cell, where it can block that viral replication. Green tea extract is another zinc ionophore that acts like hydroxychloroquine, and these are both things that are quite safe for the vast majority of people. There's very low side effect profile. There are outliers on occasion, but the potential side effect risk profile is, I'd say, probably less than 1% and not dangerous. And so those doses will be in there. I'll update that as well if they're not already in that write-up. I'm going to be updating all of that after this call. And I could continue to say some more things, but let me look at what kind of questions I'm getting already. So current medical situation in the US, and is California seeing any impact to or from the sheltering guidance yet? There's some really early indication that I came across last night in our physician groups that do seem to appear to be slowing. A lot of the rise in numbers in this state are coming about because of access to testing and not so much new cases. You haven't looked at the county breakdown other than in Marin County. The statistics I saw yesterday that we only have 3 patients currently in the hospitals in this county. I know that's going to be different down in Santa Clara or other parts of the country. Certainly way different in New York, where they're having a far more challenge than we are just yet. The early preliminary information suggesting that we may already be having some positive benefit of sheltering in place. It really is too early to tell, but that comes from not looking at the total number of cases, but looking at the hospitalization rates, because that's really where the issue lies, is not in the total numbers, but in severity and people who need medical attention. And I will continue to follow that as well. Let's see. Absent availability zinc pulconate, zinc citrate, a good alternative? Yes. So there are alternative forms of zinc. Zinc citrate is fine. Zinc carnosine is fine. There was a reference that there was only so much information I can consume at once, but I'm going to dig into it, suggesting that the picolinate form was maybe not necessarily the best idea, but we're seeing constant contradiction. There's assertions out there and collective knowledge and lots of data and professional consensus, and then somebody who may or may not have some credibility will come and present a counterpoint. And that is true of most things in medicine and healthcare and biology. And it takes a fair amount of kind of diving into the details to be able to determine, does this counter assertion actually apply to this situation and to what extent? In the meantime, other forms of zinc are perfectly fine. Zinc gluconate's another one. And perfectly fine until we otherwise have, any information to suggest otherwise. And this is a moving target, and so I will update and correct things as we go. How much vitamin C if you have symptoms? Again, how much zinc if symptomatic? The zinc dosage doesn't change if you're symptomatic because it's really about the zinc getting into the cells, and the 30 milligram average dosing is sufficient for blood levels to be at a place that will hinder viral replication if it can get access into the cell, and you can support that part of it. Vitamin C with symptomatic, I would go for 1,000 milligrams. The research that is circulating suggests every 15 to 30 minutes at 1,000 milligrams. I'm suggesting, to go for every 30 minutes, every 15 minutes is quite hard to take something. And that if you reach bowel tolerance, which means that you start to get loose stools, you have saturated your system and you no longer need to push the vitamin C dosage. And this is during waking hours, that you can scale back, take one step back from that max dose. So say, you're using 1,000 milligrams every 30 minutes. And you reach 6,000 milligrams and you get diarrhea from that. So the next day I would recommend doing 5,000 milligrams, but dividing the dose into twice a day or 3 times a day dosing. So take the division of that, roughly 1,500 milligrams 3 times a day, or 2,500 milligrams twice a day, so that you don't push yourself past tolerance. If your symptoms aren't starting to respond in 12 to 24 hours at that initial 1,000 milligrams every half hour dosing strategy, the recommendation is to double it. Vitamin C is water soluble, so there isn't really, the overdose is the bowel issue, and isn't dangerous as long as you don't continue with that and dehydrate yourself from having diarrhea. Let's see, hopefully that answered that. We don't have disinfectant, small bottle of alcohols, or any other common item. Yes, so common item to disinfect. So for rubbing alcohol, it does have to be over 60%. There's a lot of information circulating around vodka, which doesn't have the proofing that's needed for that level. It's usually up to 45% alcohol. Bleach works really well. And, this is a time where I would normally tell my patients avoid bleach because of the inherent toxicity. And this is a situation where having a tiny dilute amount, I think it's 1/4 cup per liter. There's recipes online for dilution. So you want to take your volume of water and put the ratio of bleach in a spray bottle, and then wear gloves when you use it. Try to avoid inhaling it. Wash your hands if you touch it. Chlorine absorbs most readily through the skin, and certainly through the mucous membranes. So just be careful with it. If there's a family member or anyone around you that has less sensitivities, or is otherwise not affected so much by using chlorinated compounds, have them do it instead. Maybe open the windows when you're using it and air things out. That would be a perfectly good alternative. I'm trying to think if there's any others that I've seen come across. We did not have rubbing alcohol here, so we're using the bleach option. I don't recall at the moment if there are others. If somebody knows others and wants to suggest them in the chat, please feel free. Okay, so so hypochlorous acid efficacy for hand and surface cleanser. I don't know the efficacy. I do trust the opinion and the medical background of Dr. Klinghardt, who is a huge fan of hypochlorous acid. It is, much less toxic than chlorine bleach, for example. I did not dive into the literature and the references that he provided, but it seems like it's coming from a sound source, and I'll look at that more closely. And until we know otherwise, and if you have access to it, I know even A week and a half ago, I was at a medical conference trying to make it back from that as this was all really ramping. And that was a big suggestion, and it was already sold out online. So if you have it, please use it, unless you have better alternatives until then. For hands, however, simple soap and water actually works quite well. Other alternatives would be more recommended if you were like out and about and needed to clean your hands in the middle of whatever activity or outing you were doing. But otherwise, washing with soap and water for at least 20 seconds really is effective at breaking down the like viral protein, the coating on the virus. Relationship and cytokine storm with COVID-19 and mast cell activation. Okay, so some of my patients have a condition or immune hypersensitivity called mast cell activation syndrome. This is something that occurs with like big histamine bursts from the cells that produce histamine in the body, whether it's in their GI tract or on their skin or in their lungs. There is some indication that patients with mast cell activation could be at higher risk for cytokine storm issues should they get the virus and should it progress to the degree that it affects their lungs, which is, the lung symptoms are on average starting around 5 to 9 days in to the virus. So the first thing I would say is do what you can to not get it. The second thing I would say is the moment that you have suspicious symptoms, do the things that are low risk, but have real data behind them to try to support your ability to manage it, your immune system's ability to manage it. Mast cell activation, most of the people I work with on that are using things that are intervening on those pathways, and some of those things are particularly protective. For example, quercetin being a mast cell stabilizer, and its dual effect is a zinc ionophore and its ability to get the zinc into the cells, prevent the viral replication. So the flip side argument could be that you're actually more protected if your mast cell activation is controlled. But the pathology does indicate that there could be a problem if your mast cell activation is not controlled. The other thing that dovetails with this particular immune hypersensitivity, not on a like emotional, mental level, but specifically on a neurophysiologic level, because it interfaces with mast cells, is the limbic system piece. So for those of you who don't know what the limbic system is, it's part of our neurophysiology that involves the amygdala, which is our the gland in our head that responds to the fight or flight response. And fight or flight can be from external, stress, trauma, accidents, things like that. Can also be just from chronic illness and the loop that gets kind of fed into the what we call amygdala hijack, just from being sick. And that interfaces with, a whole bunch of other structures in the brain that then has an effect on your immune system, and particularly kind of like has a kind of lock and key effect on the mast cells, but also our endocrine system and a few other systems in the body. So the things that I've, want to stress, and, for those of you that are already doing things either as daily practice or otherwise that help with your limbic system response, this is like absolutely the most important time for you to engage those practices, like, absolutely crucial. So for some of you, you're doing the DNRS, which is the dynamic neural retraining system. If you're interested in looking at what that is, you can go to retrainingthebrain.com. It's an online program that teaches you how to rewire your limbic system. We have daily practices, any kind of mindfulness-based meditation, those kinds of things that are great for maintenance, not necessarily going to help in the kind of acute phases as much as brain entrainment stuff can. An alternative to DNRS is called the Gupta program. You can look it up online. There are additionally, other practices. And like I said, I'm working to get the brain retraining coach that I'm referring to commonly these days, Michelle, on a call just like this with all of you, so we can, understand more about how to calm that neuro pathway and make us less vulnerable to all of it, much less our mast cell going crazy. What type of vitamin C do I recommend other than powdered? At the moment, because the supply is fairly short, I would say whatever you can find. The second layer of that is there is, evidence that a combination of liposomal vitamin C with any type of ascorbic acid or buffered ascorbic acid or calcium ascorbate or buffered C is ideal. One or the other of those, if you can find one of the others, is still better than none. And as I mentioned, any that you can find in terms of the supply chain is what I would recommend. But if you can, and you have the luxury or you already have it at home, a half and half mix of liposomal and buffered C, or just any, chewable capsule, etc., doesn't really matter, is fine. Have I heard about tea tree oil killing the virus? Not specifically tea tree oil. I have not looked at the data for that. There are some other factors that we've seen can kill the virus. Just like I said, the standard soap and water, any kind of detergent. That's why, just simple washing of your clothing if you've been out in public is, worthwhile and will kill it. Not kill it, just deactivate it. So there's a lot of information too, like in terms of viruses not really being live. Hard science for right now, but I don't want to use the wrong terminology either. So I don't know if there's data on tea tree oil. I will look. So HOCl, okay, so hydrochloric acid, hydrochloric acid can be made at home with a small device. I'm not sure what that device is, but if you guys can see it in the chat window, you're welcome to look at it. I don't know enough about that. And I do agree though that it is non-toxic and appears to be effective for many purposes. Modifications to supplement list for, hold on. Soap and water are effective for cleaning hands. It should be effectively, for cleaning surfaces, although my concern would be that you wouldn't have, it wouldn't be long enough, right? So like, we're having to wash hands for 20 seconds. I don't know if you would need to make a soapy solution. That's where the chemistry piece of it, I'm not so sure we've proven out, rather than killing things on contact on surfaces with something that's alcohol based or bleach based or otherwise. So that would be my hesitation for suggesting that a detergent would work on a surface, because it's not long enough exposure, potentially. So I would reserve that as a, if all else fails, until we know otherwise. It's certainly better than nothing. Any modifications for a breastfeeding mother? So yes, let me think. Zinc is perfectly fine. Vitamin C is perfectly fine. Vitamin D is perfectly fine, including in those doses. So those are my first, 3 top recommendations for prevention. If you saw the list, there are parentheses around things that suggest, not for pregnant women, and the same would go for breastfeeding moms, mostly because some of those options we don't have enough data on. And I will update that to include breastfeeding as well. But the first 3 recommendations are perfectly, reasonable to use, breastfeeding or not. I'm trying to think of what else is in the vitamin A. Has dosing limitations. It's also secondary in terms of prevention or treatment. It appears to be kind of not a bad recommendation, but not the top one. And the dosing limits or the dosing range I gave, the lower end of the limit is perfectly fine for pregnant or breastfeeding moms. I'm trying to remember if quercetin was okay. I have to double check for breastfeeding. But I will answer that when I get a chance to put my hands on take a look at it. What about elderberry anti-inflammatory meds, including ibuprofen? So the elderberry cytokine storm connection has been debunked in terms of risk. The antiviral properties of elderberry are quite well documented. It is still, suggested as another strategy for prevention. The minimal potential cytokine effect that elderberry can have is not sufficient enough to put additional risk or harm in the way should you contract the virus. So that should be fine. The ibuprofen piece of the equation is still playing out in terms of recommendations. There's a lot of discussion to just use, Tylenol or acetaminophen, with the caveat to that being that it depletes glutathione, and glutathione is one of the body's most potent antioxidants, and the way to actually prevent lung damage. And that actually maybe takes me to kind of the fourth prevention / treatment recommendation, which is N-acetylcysteine, which is perfectly safe for pregnancy and breastfeeding and otherwise. And should you need something like Tylenol for fever or discomfort, would offset the glutathione depletion risk. The ibuprofen information is still suggestive that it's less than ideal. Again, new information coming out suggesting that's not necessary. I don't have a response for that quite yet. At the moment, I would say still avoid it if you can. There are better anti-inflammatories, including things like high dose curcumin, for example. And then, as I mentioned, the Tylenol if you need it, although the immune system's response with fever is one of the ways that we overcome illness. So if you can manage the discomfort, I would err on the side of not using those things. Briefly, let me know if ear or nasal can help. Yes, we had this question yesterday. So ear or nasal ozones. If so, a few of you have ozone generating machines at home for whatever reason, and exposure to ozone gas, not by touching like close to the, onto the skin of the ears or the ear canal, but just right outside of it, actually gets into the sinuses and the nasopharynx. And we know that that the virus actually lives in the back of the throat and kind of this area of our bodies for about 5-ish days before it infiltrates further into the lungs. If you happen to have that device, you are welcome to use it. I would say more, through ears, although nose too, if you know what the settings are, but we're getting into territory that's a little bit more complex and nuanced in terms of giving dosing instructions, because that's only for a few of you here. But we also do know that, that ozone does kill coronaviruses. Ozone's, oxygen molecule that has an extra oxygen, what do I call it? Group on it, not group. I'm thinking molecule. I can't think of the terminology. You know what I mean? O3. So that would be fine. Back to the hydrochloric acid, there is some suggestion too that spraying around the eyes and the throat and the nasal passages can also cut off the virus at the pass should you have exposure and or have symptoms. And then there were some other suggestions in the initial write-up that I did. Several of the antiviral formulas, like, from Beyond Balance, and there's one from BioPure that's similar, ENV. These do appear to also have prevention and supportive effects, as does something like Biocidin throat spray, or colloidal silver throat spray, specifically local activity to knock back the viral, activity at the very first signs of symptoms. Those are all things that you could all kind of suss out and see if you can locate online for ordering. And I will update those as well. I would reserve those things. This is a prevention formula. The dosing that was put out had the issue with the formatting, and it made it look like 3 to 5 made it look like 35, and 12 to 15 made it look like 1215. And it's because the hyphen got knocked out in the formatting when it got sent out. So we'll be writing that into words, to correct it. But the thing about these, antivirals, they're fairly potent antiviral herbal formulas that are pharmaceutical grade. They're kind of hard to come by otherwise. And various ingredients in them have real data behind them in terms of how they cut off viral activity and raise viral immunity. I would still think of it as a secondary attempt or even a tertiary attempt, right? With shelter in place, hand washing, et cetera, being first. And those first, 3 to 4 prevention recommendations being second, and, this being later, in terms of stratifying your efforts. Okay, so cannula ear nasal. Do you recommend Neti Pot or other nasal cleaner after being out in public for a supply run? There is also evidence that actually keeping your mucous membranes flushed out. So Neti Pot is one option. There's also a sinus nasal bottle by a company called NeilMed. You can get online or at your drugstore that just uses little saline packets. If you don't like to tip your head up the way that the Neti Pot works, you can squeezy it. And keeping your nasal passages flushed does have real efficacy in preventing viral infection, and also keeps your mucous membranes more moist, which is also a bit of defense against respiratory illness or viral illness. And that wouldn't be a bad strategy at all. And it's easy and it's no risk and would be great regardless. And particularly after being out and about in public. Any advice specifically for young children? Young children, 5 milligrams of zinc, 1 to 2,000 IUs of vitamin D3 is pretty much all I would do for them if I did anything. Colette is getting 2,000 IUs of vitamin D every day. She's 9. So part of it's weight-based. Infants, it's even standard for infants to have 400 IUs of vitamin D3 because we don't pass much of it through the breast milk unless our levels are well above 50. And because it's such a potent immunomodulator and prevention for infection, viral illness, influenza, et cetera, it's not a bad recommendation. That, and of course, we're keeping them inside, but frequent hand washing. I mean, being out in nature is fine as long as you're not in big crowds anywhere. Obviously, here in Marin, they've closed all the parks and the beaches because people didn't know how to do that. But, children are fairly resilient anyway. There's some evidence that one of the reasons they are protected is because of their melatonin levels. That's another piece of treatment strategy, is that 5 to 50 milligrams of melatonin at bedtime, should you get symptoms, does appear to curtail the progression of the infection in some, and is preventative if you happen to be, a poor sleeper or potentially low in melatonin to begin with. Part of which is age-based. We do lose our melatonin production as we age, as just a natural part of aging, and is very, low harm, low risk. The dosing strategy I try to tell people is to use an effective dose that allows you to sleep without feeling groggy in the morning, but those recommendations kind of go out the window if you're symptomatic. I would, easily use 20 milligrams plus, even if you are groggy in the morning, because if you're sick, you should be sleeping anyway, which is also really helpful for healing. What is the name of the supplement you just said for glutathione? Oh, N-acetylcysteine, NAC. It's over the counter. Lots of different companies make it, from Designs for Health to Pure Encapsulations to Thorne Research. You can look on Amazon. You can look on our supplement vendor site. The recommended dose is roughly 500 milligrams twice a day. It can be a little bit more, it can be a little bit less. It helps you to produce glutathione. It's perfectly safe in pregnancy and breastfeeding, and pregnant women. It's even used to prevent miscarriage. And it appears to be protective for the lung effect. And that's in the literature in multiple ways for different reasons. Let's see, headache while symptomatic. So for headache, yeah. So if you were trying to treat a headache and you're symptomatic with, COVID-19 symptoms, I mean, at the end of the day, some of the other stuff that's coming out with ibuprofen is that, again, we're talking about nuances that we ultimately don't really know. This is a novel virus. It does behave like other viruses that we've seen, in particular SARS, which was part of the epidemic or pandemic that happened in 2009. But it is new. It's a new virus. So these recommendations are based on understanding pathways and pathophysiology. And if you have an occasional headache and you're symptomatic and you take some ibuprofen, it's likely nothing's going to happen. Using, high doses frequently, maybe there might be a problem. So I would suggest using that as your barometer. If you can use the Tylenol and it's effective, do that. Could I repeat the name of Tylenol or N-acetylcysteine? Maybe N-acetylcysteine. So NAC, N like Nancy, A like Alpha, C like Charlie, and you'll see it. And it's in my initial recommendations that I'm also updating after this call. So which we'll post on the Facebook page for Functional Medicine SF, and will go out as a newsletter to our patient base, and will go on a copy for anybody here that's a personal friend, will go on my personal Facebook page as well. Where are you sending out this information? Oh, I just answered that. So if you're an active patient, you'll get an email newsletter, also Functional Medicine SF's Facebook page. And if you're a personal relationship, you'll see it on my personal Facebook page as well. Do I still recommend quercetin for immune support? I do. I'm putting it in the category of secondary recommendations because I don't need everybody to go rush out and get quercetin. However, it does have this zinc ionophore effect that hydroxychloroquine has. The mechanism makes sense. A cell stabilizer. So for those of you whose allergies are kicking up this time of year in the spring, it can really calm that as well because it's stabilizing the cells that make histamine. So if you have another reason to use it, even just day to day, it's not a bad time to do that. Certainly at the beginning of symptoms, I would bring in, quercetin and melatonin and high dose vitamin C as kind of first line strategy if I were symptomatic. Those are the things I would do right away. Food as medicine recommendations. Yes. So in the update, I'm going to be giving, these are the zinc rich foods. This is ways that you can focus your efforts from a food-based standpoint, and especially if it's hard to get other things. Harder to do with higher dose options like vitamin C, but certainly never hurts to get vitamin C rich foods. Zinc might be a bit easier to get only in food-based form because the dosage isn't so high, but I'll be looking at that. I don't have them at the top of my head, although vitamin C I know is obviously in like citrus and leafy greens and a few others. Zinc, if I remember, I want to say it's pumpkin seeds and shellfish, and I will look. I'm so sorry I don't have this memorized. And other food as medicine strategies are pretty well known by all of my patients, which is to keep inflammation low. Don't eat sugar, don't eat starchy, white, floury things. Like those just overwhelm your system in general. And it's not that they're going to cause any issue with the virus. It's just going to reduce your immune resiliency. And this whole entire exercise, whether we're gonna, get the virus or not, or get sick from the virus, because many people will get it and have no symptoms. They're realizing, I think the current statistic is something over 50% of people are asymptomatic entirely, which is hard for containment, but lucky from the perspective of not everybody is going to get sick if they get it. And there is some speculation that, 80+% of the population will get the virus and create antibodies to it. It's just far, far, far fewer will actually get sick with it. So let's see, what was I saying? So food, did I answer the rest of that? I had another thought about the food as medicine recommendations. Oh, exercise and resiliency. So I just wanted to tie that back to the nervous system piece and keeping stress down and getting really good nourishing sleep and letting your system settle into what we're still unclear how long this is going to be. It's going to be a while. So just kind of surrendering to our current new normal and finding the silver linings in it, and just, being okay with what is while we learn and discover and uncover what we need to be, learning from all of this. What dose of quercetin? So quercetin dosing for symptoms recommended 1,000 to 2,000 milligrams 3 times a day, which is quite high, but in the functional medicine world, those are doses that are not unusual to our work with mast cell activation syndrome patients, people who have that, who arguably can be some of the more vulnerable and sick of the kinds of patients that we see. And there's no hesitation, for our whole functional medicine clinician community to use doses like that. From a prevention standpoint, I would go lower, maybe 500 milligrams twice a day for quercetin. But if you get symptoms, don't hesitate to ramp that up to 1,000 to 2,000 3 times a day. If you if you have symptoms like a dry cough for over a month, would you recommend to take colloidal silver? Also, biocidin could prevent or cure COVID-19 infection. Biocidin has not been proven, although it does have antiviral properties, and the throat spray aspect of it does, it seems as reasonable as most for early onset of symptoms and knocking down viral load in the back of the throat and the nasopharynx. But we don't have any proof yet as it relates to biocidin. Colloidal silver is also antiviral. We do use, in the functional medicine community, we do use colloidal silver in intravenous form, for example, for people with chronic viral infections, with great efficacy. And there is, at least currently speculation that it could help. I don't know that there's direct data for coronavirus or this particular version of it. If you've had dry cough for over a month, you should go get tested. Although there are many reasons to have a dry cough, including allergies, for example. And so unless there's other symptoms that have accompanied it, or you're otherwise worried about it, trying to use a speculative treatment for that is, it's best to probably have consult with your clinician. I wouldn't just jump to things, although colloidal silver there are, quite safe doses that you can use. I will put those in the update as best I can, and that wouldn't hurt anything, but, I would look to see what else is this dry cough related to. We don't really see a dry cough that isn't progressing to anything else for over a month as a COVID-19 symptom, because those patients would either, their immune systems would kick it, and they would get over it, or it would also obviously potentially come with other symptoms, or they would get far sicker and seek other medical attention. Besides grocery shopping, what food delivery from restaurants is that not recommended? Even we dispose of packaging, comes in and we heat the food. Current guidelines, including in the medical community that I'm part of, is still that it's okay. It would be smart to bring home the food and discard the containers. There is always going to be risk that someone is asymptomatically shedding and not taking precautions, and that is going to be true of your grocery store food and otherwise, and you have to decide where your particular risk threshold is. We're not really doing much in way of takeout or ordering here. We're mostly cooking, but lots of things are theoretical, right? We don't know. So use your best judgment. Certainly take it out of the packaging. I know that there's a fair amount of awareness with restaurants and takeout establishments that may be using additional precautions. If you wanted to find out more, maybe they would reveal that to you if they were taking extra steps. I really don't have a good succinct answer about that. Am I going to do a summary? Please say yes. This is a lot to keep up with. Yes. So I'm going to update the summary from what I had sent out, I think about a week ago, which was a newsletter, which is also posted, I believe, on the FMSF Facebook page, and I will be updating that accordingly. Some of the limitations from that information that first came out to now is just one, trying to identify where to focus your efforts so that you're not also making yourself crazy trying to do everything. The second one is just, trying to work with supply chains and availability, and, want to just continue to emphasize that if you didn't, nothing else but shelter in place and tend to your self-care, that'll go a long way. And I don't want you to feel like, oh my gosh, I got to go get XYZ. If you have it, great. If it's easy to come by, awesome. Things are changing in real time. And so things will come available and we'll have more supplies, and, there's going to be some strategy, I'm assuming, that will be announced at some point, nationally or even regionally, around treatment options. Our FDA is notoriously more cautious that we're around being able to provide any approval for off-label use of the drug combination that appears to be effective, although there is a little bit of anecdotal info in the physician groups that there's some on both sides. One, that they are using it in certain hospitals, the combination of hydroxychloroquine and azithromycin with effect, and others that it's not quite as responsive, but also depends on how sick somebody is, and then plenty of places that haven't brought it into use yet, and a lot of restrictions that are coming out across the country from pharmacy boards saying, don't prescribe this, or if you do, you have to be able to prove XYZ. So it's not like you can just stock up on it, and just in case, it does have risks. But I'm assuming that as we learn more, this is there's lots of quick turnaround times happening, faster than most things ever, get approved or guidelines that change in this country. And that's a good thing, right? So I'll be paying attention to what that is. And so hopefully that answered that. Yes, but I will update the summary to kind of try to group things into priority, along with answering some of the things, the details of things that I couldn't answer in here. If using a nebulizer, what can we use for prevention or stress lungs? So if you standardly use nebulizers, and you have, asthma medication, for example, if you are more symptomatic from an asthmatic standpoint, you use your nebulizer as you normally would with your asthma medications. And that is true even if you were to get sick with the virus and you were having breathing difficulties. Albuterol is, reasonable for being able to breathe if you have those symptoms and you already have this stuff on hand. Colloidal silver has been mentioned. I don't have proven dosing on that yet, or seen enough data to make it a blanket recommendation. Never mind that none of these recommendations are blanket. These are just guidelines. Everybody is their own, snowflake individual, and I'm trying to provide information as best I can, with, of course, the caveat being that this, I'm not telling this to everybody as your doctor and you should absolutely do this. I'm giving it to you for information to consider. And if you have specific concerns or questions about your particular case, to please inquire. So I'm not quite comfortable yet on the nebulizer front about saying, yes, you can use this or that. There's challenges even in recommending other things. Although if you do get the virus at the first signs and you are my patient, I want to hear from you. I will try to leave some time open so that we can connect in an appointment and I can deploy reasonable other specific recommendations. We do use glutathione in nebulizers, which is the, kind of the end product that N-acetylcysteine makes. I really want to emphasize trying to do what you can for prevention. And if you are one of those vulnerable people who already needs nebulizer treatments for your respiratory, chronic respiratory stuff, to have the supplies you need that you normally need so that you don't have to rush out or find a way to acquire it should things worsen a bit. Please ask if they have a follow-up. Okay, so I don't know if there's any other questions, or if anybody else has anything they want me to discuss. If you would like me to, kind of continue holding little Zoom conferences as I'm able, and there's more information to share, or you have other topics or new things that you want me to, expand on, I can continue to do this. I see, yes, please do. Yes, please. Okay. The trickiest thing at the moment is, one of my colleagues wrote today that this virus and all the things that come with it are putting an extra 4 hours of work on her plate every day. And I feel the same way. Things are a little stressful at the moment, just from the workload. And I'm trying to balance taking care of, of those of you that are in my, on my current schedule, and trying to provide and just be at least a source of information that I hope is more calming than not. And so I will continue as best I can. I'm trying to think if there's, a way that you want to even, you can post questions also to our Facebook page, potentially, the FMSF Facebook page, and I can answer those as they come about, or I can collect them as we go. Another thing is, if you are an active patient, you can send them as, this is one of my questions about this virus. Can she touch on this the next time that she either puts out a newsletter or does a Zoom call? That would work as well. And as much as, as I said, I'm seemingly seeing some information a bit sooner than average population, also kind of teasing out what's important to pay attention to, what's not. Never mind just looking at, the data really closely, and the debates and the scrutiny, and really trying to help you guys filter, hearsay, noise, overwhelm, too much info, wrong info, etc. At the end of the day, if you are my patient, and you have specific questions to you, reach out to the staff and say, hey, I'd like to get on Dr. Daniel's schedule just to ask questions about this. And we'll do what we can to accommodate that. I'm so glad that this was helpful for most of you. If there's any other comments, you're so welcome, everyone. And I just, I'm hopeful that we'll all weather this, storm and come out with, a brighter future, because it's also really waking the planet up in a way that is remarkable. Thank you, everybody. Sorry to get emotional. Some of you know that too. But thanks for being here and tuning in, and we'll be in touch. Okay? And take care. Bye-bye.